Hello there, you absolute legends. Emma McElhinney here with Piss Off Perimenopause and the musings of a bullshit queenager. I am here to ruin your misconceptions about perimenopause, fat loss, and kick midlife in the face. So if you think your 40s are a drag, think again. Because every week I am going to be stripping down the myths about perimenopause. I'm serving you raw, unfiltered truths about your health and smashing misconceptions about fat loss. And a whole lot more. So if you thought you knew midlife, you don't know the half of it. Aging is inevitable, but getting old is a choice. So buckle up, grab a glass of something yummy, and let's get to it. Hello and welcome to the next episode of Piss Off Perimenopause and the musings of a bullshit queenager. And we have a fine bullshit queenager with us today. Do you like what I did there? That was clever. That was clever. I have with us Dr Louise Cumbley, who is coming to talk to us all about therapy. Right. So why are we talking about this? So first of all, welcome, Louise.
Hiya.
We'll get to you in a minute, but I'm just going to do a little bit of preamble about why this is important. So we have seen as a nation a huge increase in the last few years with the amount of people approaching therapists or wanting therapy, accessing therapy. And there's a range of different options. But one of the concerning factors is there are lots of people, I don't actually have the number, lots of people that are maybe accessing the wrong type of therapy or not appropriate therapy or quite frankly, dangerous therapy. And this is something that has affected me in the past year and multiple clients of mine. So if it's affecting like that small group of people, then it's affecting the larger population of perimenopausal women. So I wanted to talk to Louise, who is a clinical psychologist, about this. Now, one of the big stats, when I was doing the research for this, and this was quite a horrific stat, but in between 2021 and 2022, which we now know as the fuckery COVID years, there was an increase in 20% of people accessing talking therapies in just 1 year. Just 1 year. So I'm going to talk to Louise, Dr. Louise. We're going to call it's like Dr. What is it?
Don't call me doctor.
Dr. Louise. Dr. Louise. It's like I remember that Friends episode years ago, and it was Dr. Bobby. That's what Dr. Louise. Right, Louise, say hi and give us a little bit of a preamble all about you.
Okay. So yeah, as you say, I'm a clinical psychologist. So I'm a consultant clinical psychologist in the NHS. I've been a practicing clinical psychologist for 20 years.
She doesn't look that old, people. She does not.
I started as a child, clearing the chimneys or something. I was sweeping the chimneys at 12. No. So I've been in the NHS for about 30 years. So this is one of the things I'm really passionate about, is making sure that people access the right help at the right time from the right people. And we see a lot of that in the NHS, people who've had maybe private therapy or therapy elsewhere, and then they come to us and they go, oh, that's what good therapy looks like. Right, okay. What I had before, oh, that wasn't great. So yeah, that's a real worry.
Yeah. And I totally get it as well. And one of the things that I'm seeing a lot in the health coaching space is there are lots of different people referring to themselves as therapists, but I can't really differentiate what is the difference between that type of therapy and that type of therapy and that type of therapy. So from I suppose a big question is, how can Joanne Public, that's me, tell the difference between somebody who is qualified, or what are the levels of qualifications? What should they be looking for?
Okay, so there's a couple of things. So some of the psychology professions, so psychotherapy professions, are regulated. So psychologists who practice in this sort of space have to be regulated with the Health and Care Professions Council. So you can Google it, it's HCPC, right? So I'll give you an example of somebody who's a psychologist. So you can look me up if you want. I'm on the register.
Can we?
Yeah. But so I'm sure you've all watched The Traitors. Okay, brilliant TV show that shows, what the witch trials were like in the 18th century. There's a psychologist involved in that program. She's called Victoria Plant. Okay, so she's on the credits. and she talks about being a regulated counselling psychologist. Okay, so in order to call yourself a counselling psychologist, you have to be registered with the HCPC. So if you went on their website, check the register, put in the surname, practitioner psychologist, she will come up. Equally, I would come up as a clinical psychologist.
Is it star rating? Do you have a higher star rating than her?
It doesn't give you any rating. It just tells you roughly where they're based. So like a nearby town or city, doesn't give their address, and tells you what category. So there's about 6 or 7 categories. So clinical and counselling are the ones that tend to be the ones people will see who are offering psychological therapies. But there are others like educational, health psychologists, forensic, sports and exercise, occupational, things like that. So if someone's calling themselves one of those titles and the word psychologist, and they are not on that register, they're breaking the law. Ooh. So you cannot call yourself one of those titles unless you're registered. And that means that they've checked your qualifications and you are bona fide. And it also means if someone's got a complaint about your practice, they can contact the HCPC and say, this person did this, and they will investigate that. And if it's the allegations are found against you, you could be struck off and not be able to practice. So some people call them, what you want to watch for, right, is when people don't call themselves one of those titles, but one of the other different ones. So child psychologist, developmental psychologist, research psychologist is fine. They're working in universities usually. When you go on someone's website and they just say, I'm a psychologist, because anyone can call themselves that, right? Probably means they haven't got one of the necessary qualifications to do therapy. So that's one of the things I'd look out for. The other people will be things like counsellors, psychotherapists. Now, they have professional bodies, but you don't have to be registered with them, and they don't have any real powers to stop people practicing if they do anything naughty. So, and there has been a lot of stuff in the media. Counsellors are desperate to have a proper registration like we've got to protect the public, because that's what we should be doing. And I completely agree with them. Some great counsellors out there. So, yeah, you can check. So you can check my qualifications if you want. I'm there. I promise you.
If I was technically able to, I would go back and do a screenshot and put it on the screen, but I'm not going to do that. So
that's okay.
It would be cool to do that.
But it is really handy that the public are able to see, is this person bona fide? Do they have a qualification that's appropriate? What was the other bit of the question? I've forgotten already.
That was it really for that one. But one of the things that really confused me when I was entering that world of I need to find somebody to talk to who's the best person for me was the therapist versus counsellor versus performance coach.
All right, okay.
And it seemed to be people were using these terms interchangeably, but without there wasn't any real, anything official to say, this is what this person does. This is what this person does, and this is what this person does. And I eventually, when I started working with my lady, who was very good, and I really did take a lot from the sessions, she was qualifying, so she was already qualified in whatever level, but she was upskilling herself for psychotherapy.
Okay, yeah.
But it was that difference between what's therapy and what is counselling. Is there a difference?
Yeah. So counselling is another word for therapy. So counselling is a very broad term for offering some level of therapy. So the evidence for counselling, so the other place you can look, so I'm going to tell you about a place and you'll go, that sounds like a film. So there's a website that's called the Psychological Therapies Matrix. So if you Google Psychological Therapies Matrix, right, you will not get clips of the film. You'll find yourself on a website run by NHS Education for Scotland, which lists all of the evidence-based therapies for a particular problem, right? So say you've got depression, you can look on that website and it'll tell you what are the evidence-based therapies for depression. Or if someone is saying, I do a particular type of therapy, like someone was talking to me yesterday about narrative exposure therapy. You can go on there and it'll tell you what the evidence base is for. So for that, it's things like psychosis and hearing voices and trauma, right? So, and it'll tell you how good the evidence is. So counselling has got really good evidence for bereavement and relationship difficulties. Okay, so that's where the strongest evidence is for those things. If you want to be, there are other counsellors do offer like CBT, for example, which is really good for depression, anxiety, and all sorts of things. So it depends on what type of therapy your counsellor is offering. Okay? So different counsellors offer different sorts of therapy.
That makes more sense.
Yeah, so they're not all the same. So if you go on their website, they may say, you know, I do CBT, I do narrative exposure therapy or trauma-focused CBT. You know, you can go and look those up and see, actually, is that what I need?
Right. So, and I also want them to have some kind of card that says, I'm on the matrix. That would, so if anybody within that matrix organization is listening to this, please take note. That would be, give your participants that card. Thanks.
Yeah, well, that's because so a lot of psychologists in the NHS have helped to the matrix has just been rewritten. So we have to help put together all the evidence tables to show which therapy has got the research evidence behind it. So it now features on the matrix or has disappeared off the matrix because the evidence is showing it doesn't work. So
I'm just not kudos to have a badge that says I was on the matrix.
And now I'm not.
I'm not on the matrix anymore. Right, flipping it round. So talking about approaching therapy. And back in the, how old am I now? 46 or 47. So going back to Friends, right?
Oh,
and
yes.
That kind of era where American culture was like coming over here and it was the norm. And it was like every TV program would be like, oh, I was speaking to my therapist, I was speaking to and we were all like that. Just get on with life. Come on, get a grip of yourself. But it's obviously more and more apparent and needed now. So from the point of view of somebody that's like, is that something I need? I don't know what I need. What should somebody be looking out for internally to start that conversation or to start looking?
Okay, so I guess it depends. What we talk about is functional impairment, right? Which sounds really fancy, but basically what
really fancy.
Does sound like that, doesn't it? Okay, so basically, how impairing is the difficulty that I've got? So I'm going to do a bit of disclosure here. I am utterly terrified of spiders. Utterly terrified. Only particular types. Childhood trauma. Emma, just go with me on this.
What? Which ones? Though? What particular?
House spiders. You know, the standard ones. I don't mind little tiny ones. I don't even mind tarantulas actually, but it's the house spider. You know, terrified of them. Fortunately, I don't. I mean, I live in a house that's got quite a lot of spiders in it, but it's manageable. But I couldn't live in Australia, for example, because they're everywhere and they're terrifying. Okay.
Well, I did live in Australia and I didn't actually come across that many spiders.
You say that, but I've seen plenty of things of people who find them under their sun visor and in their homes, and no, it's just not happening. Okay. I don't particularly need to seek therapy for that because it's not having a huge impact on my life. Okay. It's not stopping me from going to work. It's not stopping me from socializing, living in my house, any of those things. It's not a major problem. So I guess it's thinking about whatever the problem is this having a major impact on my life? Is it interfering with my day-to-day functioning? I would start at looking at some of the self-management things. So NHS Inform is a fantastic website. I would say that because it's from my employer.
Have you had a hand in making some
of it? I didn't have a hand in that one.
No.
Well, I don't think so. Maybe. Who knows? I might have done actually some of the anxiety stuff. So you can go on there and get lots of information. There's lots of really good self-help books out there. One of them that I recommend to people is a series called the Overcoming series. So overcoming depression, overcoming anxiety, low self-esteem. There's also ones for parents. So overcoming your child's fears and worries, for example. They're all from a CBT slant, which has got really good evidence for those sorts of conditions. And it's really well structured, gives you things you can do at home. Okay, so I'd start with that. If I'm like, no, I can't do this on my own, I need someone to help me, then you probably need to find yourself some kind of therapist.
And as the first port of call, should that be your GP or should that be?
Yeah, I would go and speak to my GP. Some GPs have mental health nurses now in their practices, certainly in Scotland. So you can go and have a conversation with them and they can access the right support for you within the NHS.
Ours is really good. Like, I know a lot
Excellent.
of GP practices get slated, but ours, like, in general, like, we have access to mental health services. There's any
Yeah.
mental health nurses that are based in another part of the town. We've got our own in-house physio that you just self-refer to as well. Like
Yeah.
that. Oh, I don't really understand why everybody's complaining, but no, not everywhere has, I suppose, the same level of services, do they? I do have a particular opinion on what I'm going to ask you next, but
Okay.
that's just the nature of my job. From your point of view, do you prefer seeing patients in person or online? Is there
That's a really
is
good.
there one that's better than the other?
So I think if you'd spoken to me before COVID, I would have absolutely said, I'm an in-person girl. See that stuff where people are talking about therapy online. Nah, it can't be anywhere near as good, right? We were actually starting to trial online therapy just before COVID hit. But actually, it's been really, really effective. It's meant that patients are able to. So I have one who we have appointments in the car park outside work before they go into work. So that means they haven't got to come out of work, trek miles to come and see me and go back to work.
I just had visions of it being like some kind of James Corden, like car karaoke.
I'm not in the car. I'm not in the car. They are. I'm in my office. But what we're finding is that, yes, absolutely, it's just as effective. Actually, it can be a bit quicker and you get to the point much more quickly because you haven't got the distraction of other things of being in a room, having to get to and from an appointment. You tend to get to the nub of it much more quickly. However, there are some people that I really want to see face to face, and we just benefit from whatever, particularly for people with really complex difficulties. It's
Yeah.
much easier to have them in the room, or where there are family members I want to involve, or where they live in an area with rubbish Wi-Fi. I mean, and that is still a problem for some parts of Scotland.
Your part of Scotland.
Yeah, there's bits where I think there's still kind of that old, the old Wi-Fi where it used to make those funny little noises.
But you can't use the landline at the same time.
No, you can't use the landline at the same time. Yeah. So, I mean, city dwellers will be laughing at this, going, "Really? Does that still happen?"
No,
But, yeah, it
it's
does.
like so my mum and dad live 45 minutes away from me down a main trunk road in Scotland. And there's gaps. There's about a 20-mile gap, but you can't even get digital radio. So what is it they call it? Broadband poverty, digital poverty.
Digital poverty, yeah.
There's definitely it's still real life and like we're a fairly populated area. So up in the Highlands it can be wild. And in the borders in your locality, there is nothing to see here for many, many miles.
But I think it's really good for some people, particularly with work. It's really handy that people can just not have to drive a long distance, that they can just connect with people. We found it really, really helpful for some clients, but it's not for everybody.
Yeah. I think as well, a lot of people maybe feel quite anxious about the concept of therapy anyway.
Yeah.
And then being able to be in your own safe space or environment and not having that like, oh my God, I'm having to go to a hospital or clinic or it just kind of takes away that element as well. And certainly like if you're working like with busy people, like I personally would much rather to do things like that online rather than have to go and get in the car and drive.
Yeah. But for some people, it's not possible, whether because they share a house with other people or they've got a partner that they don't want them to hear what they're saying, etc. So, it isn't really a safe space for them. Sometimes it's quite helpful to do that online stuff because you get to see a bit of people's homes, and sometimes you can spot things and you go, oh, what's that all about?
Well, but the one that I was accessing, it was you must be in a room with a closed door and there's a signal that if you don't feel safe, you can give a signal, and can you avoid having children in the house at the same time and whatnot, which I thought was very, very thorough, and that kind of made me feel a little bit safer that actually this is legit and it's not kind of some mad charlatan. Although she did start talking about crystals at some point, I was like, no.
So Absolutely, we say the same where I work, but equally our staff are also in a clinical base like I'm in. So we don't have our staff doing that from home invariably, because equally you need to know that their husband isn't in the next room cooking the tea, or the kids aren't running around. You need to know that the information you're sharing is confidential and private.
Yeah. And what would, so regardless if it's in person, regardless if it's online, you mentioned about people coming to you or one of your colleagues and going, oh, this is what it's meant to feel like.
Uh-huh.
What is good therapy meant to feel like?
Okay. Yeah, it's a massive question. Okay, so absolutely it's about safety and trust. Psychological therapy, as a patient, you have to completely trust me and tell me all sorts of shameful, scary, upsetting things. Okay, so I love my job because I get to hold on to people's stories and look after them for them and help them with them, right? And it's a massive privilege. But it comes with a huge responsibility that I have to practice carefully and safely with the information that they share with me. So there's obviously all the things about confidentiality, which is standard across the NHS. We don't go blabbing to everybody in the street. The challenge is sometimes I might bump into my patients because I live in a small community. So that does happen. And I always say to them at the start of therapy, see, if I see you in the street, I won't acknowledge that I know you. If you want to say hi, that's fine, but we're not having a chat in the street. Just we move on. So, normally therapy involves an allotted time. So about an hour, weekly, fortnightly. And really, we should be sticking to that. So I don't phone my patients outside those times. I certainly wouldn't be texting them or messaging them, from my private mobile. And I certainly wouldn't be meeting up with them for drinks and parties, right? So I know.
Remind me never to employ you as my therapist.
I've said to people before, I'm your therapist, I'm not your friend. And that's, it's a completely different relationship. And the two shouldn't be blurred. And it's people don't know what therapy is because it tends to happen behind a closed door between two people. So the public have this thing that's like some kind of dark art, like some kind of magic circle thing. But really, it's two people being in a room talking about one person's problems. And the other person is listening, reflecting, and thinking about how we might be able to help. If your therapist starts talking about their own problems, like you would with a mate. So if you're with a mate and you're sharing something and they go, oh my God, that happened to me, right? That's fine. But your therapist should not start disclosing their own personal stuff or talking about them. It's your time, not theirs. So what we do is we come up with a formulation. So what's the problem? How did it start? What's a bit of your background? What's keeping it going? What makes it better? That kind of stuff. What we tend to focus on as a clinical psychologist, I tend to focus on what's keeping it going, what we call the maintenance factors, because that's the stuff where we can achieve progress. So what are the things that are keeping you stuck in that same rut or making things worse, right? So you come and see me, we have those conversations, we have a shared understanding what the problem is. I send you away with some tasks to do each week, right? And in between sessions, you're doing all that work on your own. And then you come back. So we should be meeting weekly, fortnightly, maybe for about 6 to 12 sessions, maybe a bit more, depends on the problem. But it's a purely professional relationship.
And should it feel quite uncomfortable at times, or is that a bit of a made up thing?
No, it is uncomfortable because, as I say, lots of people are sharing things that are really personal. If it feels very superficial, it's not going to work. I've actually just seen a patient, and all of our clinic rooms have lots of tissues in them. And she said to me, is it normal that you make people cry all the time, Louise? And I was like, well, it's not that I get bonus points for making you cry, but getting to the point where you're feeling really vulnerable and upset is probably we're getting to the sweet spot in therapy, that we've probably hit the point where you're talking about stuff that really matters and really makes you feel. And that's the key thing. Am I talking about the stuff that really matters, or am I on a superficial level like I would be with my mates going, well, no, everything's fine, but really it's not.
Yeah, it's interesting, isn't it? Because I suppose you'll have different people as well that are really prepared and willing to be open early, and they built, you get that trust quite early on, and then you'll have people that will take a longer burn. They've maybe had, poor therapy before. So for you, is that kind of the sweet spot, that kind of 12-week kind of like,
yeah, so
if you get to that time, you go, right, there's no fixing you now.
No. So what we tend to do is we tend to go, look, and a good therapist should do this for you. They should give you a kind of, if it's private therapy, they should be giving you a bit of a contract. This is what you're signing up for. This is what you need to agree to. Excuse me. And we'll meet for a few sessions and then we'll keep reviewing it as to see whether this is beneficial or not. And we do the same in the NHS, but they really shouldn't be just going, right, open-ended, you're coming for 20 years, because you're just signing a blank check for them, aren't you, if they're private therapists. But, you know, for CBT, you should start to see some impact of that within a few sessions. 3 or 4 sessions, you should start to be going, actually, this is working. Of course, if you don't tell your therapist everything, we're not going to hit that sweet spot because you're keeping stuff back. But, you know, we're not psychic. So you have to tell us stuff because we can't read minds, and then that's a surprise.
Oh God, I have written that exact phrase today in something that I was doing, but I'm not a mind reader. I'm very good, but I'm not a mind reader.
I'm good at my job, but I'm not that good. I mean, sometimes we can spot that people are holding things back, particularly if therapy isn't progressing. We're like, there's something else going on here.
Is that something you're trained for, or does that come with experience?
No, it comes with your training as well, because people are complex. If people were really simple, I wouldn't have a job. Like, that's the reality. People are complicated. We are the products of our childhoods and our parents' childhoods and so on. So we are complex beings. So, you know, you pick up the cues and signs that actually think there's probably something else going on here. And yet some people can trust really easily and go, here you go, Louise, have everything.
Oh.
Yeah. And other people are like, let me just test the water with you and see what you do with this story. Oh, and let's see what you do with this. And that's okay.
Yeah. You've got to be so skilled, don't you? It's so nuanced that like the amount of people that you see, and no 2 people are the same.
No.
It's like, it must be, you must go home at night absolutely exhausted. Like, just like, oh my God.
But I mean, I've talked about what a privilege it is, but also we have to remember that therapy can cause harm. This isn't a benign process, is what I say frequently. Therapy is not a benign process. It has real impacts on people's lives, majority of the time for the positive. But see, if you start dabbling in this stuff when you don't know what you're doing, like you wouldn't just start dabbling in brain surgery. Oh, well, I've watched, I don't know, some medical drama, so I'll start dabbling this. You wouldn't do that, would you? So, you know, oh, I saw, I don't know, on Holby City, someone have their appendix removed, so I'll give that a go.
Knowledge isn't always power.
No, it's not. See one, do one, teach one, or something that someone said to me once. You know, just because you've seen someone else do it doesn't mean to say you can do it yourself. So just because it seems like we're just talking, in inverted commas, doesn't mean it can't do harm, because it does. Words have a lot of power.
It really does. And I'm not going to speak of my own personal experience from that, but yeah, it really does.
Yeah.
It's tough. But anyway, right. So I was going to say, where can people find you? But you don't want people finding you. So, because normally I'm like that, right? Where can people
No,
find
I'm not
you
running a business.
or work with you? And you're like that. Please don't.
Yeah. No, in all seriousness, people, you know, they can speak to their GP. There's some good online resources I've described. There's also what we call Silver Cloud, which is a digital therapy package. So you do it on a computer every week for about 8 weeks. That can be really helpful. Your GP can refer you to that as well. So that's only in Scotland. But if you need to see a psychologist, you can go and see any psychologist in Scotland. It doesn't have to be me. There's lots of fantastic psychologists in Scotland other than me.
I definitely don't see her online because our Wi-Fi is terrible.
Got a bit better.
Right, so can I just summarise the name of that website? The accredited body was HCPC, is that right?
Yeah, Health and Care Professions Council. Yeah.
Okay. And we were going to touch on something else, but I think we're going to do another episode on, well, we might do another episode. I'm not even going to talk about that. Okay. Thanks, Louise. Thanks, Dr. Louise.
You're very welcome.
Dr.
So tell you a funny story. So my friend calls me Dr. Little Lou, as in Dr. Doolittle, but Dr. Little Lou.
Oh.
So maybe I'll set up a private business and call myself Dr. Little Lou.
Don't do that. That's red flags all over it straight away. Dr. Little Lou. I don't do that. Okay, well, thank you so much. That's been really helpful because I think like I'm a normal person for the most part. And if I'm getting confused with all the options out there and given the massive increase in the amount of people seeking therapy for mental health support, for trauma, for neurodiversity, it's another one people are seeking a lot for. It's got the potential to be really damaging, what you were saying. And I just wanted to do this episode to kind of get some basics out there about what people should be looking for and what they should be thinking about for themselves, and to not necessarily get caught up in this everybody needs therapy mindset, because as you say, if it's not impacting your life in any negative way, then actually maybe having a bit of journaling session to yourself or talking to a pal about it is all you might need.
And if you really think you need therapy, do your research, okay? Do your research about who the person is, what therapy they're trained in. And that red flag for me, if they list, I work with children, adults, older adults, everybody, and I can do all these therapies, you're going to be a bit anxious about that, as opposed to someone like I would say, I work with children and families. These are the therapies I'm trained in, and that's it. And less is more in this field.
And that's one of the things, like, and even speaking as like a business mentor, when I see things like that, when I was looking at it, I was like, I do integrative therapy, trauma, this therapy, this, and I'm like, you need to find out who it is that your person is, who is it that you want to work with, and provide that solution to that person, and not give 20 different options. Because I might need something for something. I can't even think of things. So I'm not going to choose a relationship therapist for that, because I'm actually not in a relationship anymore. So, like that would be awkward. Hi, relationship with self-counselling, help.
You can actually go along to have relationship counselling on your own, but yes, I take your point.
Is it Relationship Scotland?
Yeah,
I can't remember. There was a big site that I was looking at the last year before. I can't remember. And that was one of the things that you don't need to be in a relationship for this, or you don't need to be a partner for this. Anyway. Right. Okay, that was a good confab. Thank you.
You're very welcome.
Enjoy the rest of your day, and don't contact Dr. Louise, everyone, because she's not available. She's very busy in the NHS.
Thanks very much.
Thanks, Louise.
Take care.
And just like that, we have spiced up another episode of Piss Off Perimenopause and the musings of a bullshit queenager. Massive shout out and a huge thank you for hanging out with me today. I really hope you've been entertained. And remember, don't be shy, hit that subscribe button. And until next time, keep those heels high and standards higher. Remember, it's all about glowing, growing and downright owning it. So catch you on the flip side, and don't forget to click the link in the show notes to get your freebie.